Greetings from Citizen Health and the Team Academy IPS and eConnect. And today, in the series of People's Health It Matters, again we have Dr. Vidya Jeevan from Bangalore to answer our few questions on child sexual abuse. And since we all know that it is very sensitive topic, just welcome, ma'am. Welcome once again in our on our platform for this talk.
Thank you so much, Ritu, for having me again. It's truly a privilege to be here.
Thank you so much, ma'am. And without wasting any more time, I just wanted to ask my first question that what is child sexual abuse?
Yeah, see, child sexual abuse, as per the World Health Organization, refers to the involvement of a child in sexual activity that he or she does not fully comprehend and is unable to give informed consent to, or for which the child is not developmentally prepared and cannot give consent, or that which violates the law or social taboos of society. There are various forms of sexual abuse. It could be forcible kissing, touching or fondling a child, photographing a child in nude, exhibitionism, that is forcing a child to exhibit his or her body parts or exhibiting before a child, exposing a child to pornographic materials or prostitution, exploration of sexuality among minors, online luring by cyber predators or by pedophiles. So pedophile is a person who is sexually attracted to younger children. This has increased during the time of pandemic due to lockdown and everything, and even rape. So all these come under sexual abuse. Sexual abuse, in simple words, is involvement of a child in sexual activity. That is using a child for sexual stimulation. A child is a person who is aged less than 18 years. It can happen by anyone, by an adult, another child, or a relative, close relative, family member, neighbor, anybody for that matter.
Okay, so we are talking about it. Is it that much important? So why is it important to know? Is it very common?
See, children under the age of 18 years contribute to around 37% of India's population. A large proportion of this population is exposed to lack of access to basic education, nutrition, and even healthcare. In addition to this, they are more susceptible to childhood abuse, which further makes them vulnerable. Child sexual abuse is a serious public health problem because it affects millions of problems each year worldwide. It is said that 1 in 2 children experience abuse during their childhood. See, if you look at the numbers, it is around 8 to 31% among girls and 3 to 17% among boys. It is seen in all genders. Yeah.
So what can be the consequences, ma'am?
See, experiencing sexual abuse during childhood can lead to consequences at various levels throughout the lifespan. They can be physical health consequences, mental health consequences, and even behavioral consequences. So the physical health consequences include transmission of sexually transmitted infections. It could be HIV, hepatitis B, syphilis, herpes, and there are various others. Or there can be physical injuries to private body parts. There can be unintended pregnancy. They are also more prone for chronic conditions like heart disease and obesity. This happens mainly because they're more prone for stress, and they can be lifestyle changes followed by sexual abuse. So this is about physical health consequences. Mental health consequences include depression, anxiety, post-traumatic stress disorder, panic disorders. And if you look at behavioral consequences, there can be substance misuse, risky sexual behaviors, that is having sex with multiple partners, increased risk for perpetration of violence, that is they can cause harm to others, and increased risk for suicide or suicidal attempts. So to sum it up, it can interfere with overall growth and development.
So for the parents who is watching the video, the most important question is how anyone can suspect. What are the warning signs of it that the child is getting involved in these kind of acts?
Yes, this is very important. See, if we see any unexplained behavioral changes, for example, if the child is refusing to go to school or refusing to interact with any particular friend, relative, driver, neighbor, it could be anybody with whom they were comfortable before. Or if there is a decreased academic performance, refraining from play or social activities, if there are any symptoms of depression, anxiety, self-harm, if we observe sexualized behavior in a child, okay, if it is a very small child, we can see bedwetting, change in sleeping pattern, eating pattern, there can be nightmares, Or if it is older child, there can be substance abuse, that is consumption of alcohol, smoking, drugs. There can be recurrent urinary tract infections, painful micturition. So painful micturition is pain while passing urine, and also pregnancy in an underage girl. So these are all the signs we should look for.
And once, unfortunately, any parent come to know that the child is involved in this kind of act, so how to address this?
See, the most important measure would be including sex education in schools, which is happening in few schools already, and also at homes. See, parents and school teachers have an important role to play here. There are two things here. One, the first thing is we need to build a proper parent-to-child relationship and establish a foundation for future interaction. Okay, so we need to spend more time with the children and let them feel that they are being loved. Children usually hesitate to share such experiences because of fear or guilt. Abusers take advantage of this and gain trust and tell the kids not to share such things with anyone and keep it as a secret. So, our relationship with our children should be so strong that they should not hesitate to share any thing. They should not hesitate to disclose anything with us. The second thing is we should choose the right time, right age to start such conversation. So if you ask me, we can start this as soon as possible, latest by 5 to 6 years. So again, it depends on the age. If it is a smaller child, we can start with naming body parts, using proper names, of course. And we can teach them about good touch, bad touch, using various sex education materials available. So good touch can be pat on back, high fives, or even shaking hands. Bad touch, pinches or touches on private body parts, which makes her feel uncomfortable and nervous. So we need to teach about such things. And if it is a teenager, we can give sex education in detail.
Right. So, what can we do if it has already happened?
See, there are some tips for all of us to follow here. We need to understand that we need to stay calm and control our anxiety. We cannot have an emotional breakdown in front of the children because they are very sensitive, right? And then we need to trust the child until proven, and we should not blame the child, okay? And we should be ready to answer the child's anxieties and queries. If required, we can seek help from mental health care. If required, one can seek help from mental health care professionals and counselors. So at the individual level, this can happen. And there are various organizations which are working towards this particular cause. So we can contact them for support. At government level, we have some acts and policies to protect our children from sexual abuse.
What kind of act, ma'am? Can you please a little bit explain these acts?
So this act is called as a POCSO Act, that is Protection of Children from Sexual Offences Act, which was implemented in the year 2012. So this is mainly to provide for the protection of children from offences of sexual assault, harassment, pornography. It incorporates child-friendly procedures for reporting, investigating, and recording. And also it provides for stringent punishments, which have been graded as per the seriousness, severity of the offence.
Thank you so much, ma'am. Thank you so much for all these information. Any take-home message?
See, Ritu, child sexual abuse is a dark reality. Sadly, it is a lived reality for many children in India today. As parents and caretakers, we should be very cautious, always keep an eye on their activities. Most of the times, it is by someone known and trusted by the child. So it's our responsibility to ensure a safer environment for our children to grow. So we need to work together to protect our children from sexual abuse and help them lead a healthier life. Thank you.
Thank you so much, ma'am, for such a informative talk with us. Thank you so much.
Thank you so much, Ritu. It was great talking with you. Thank you. Have a great day.
Great day, ma'am. Same here.